KwaZulu-Natal is in its third wave of COVID-19 infections, and schools are emerging as the biggest contributor to the rapid increase of new infections in the province. Premier Sandile Tshabalala has also raised concerns over some pubs and restaurants flouting level 3 lockdown regulations. Let's speak now to Head of the Health Department in KwaZulu-Natal, Dr. Sandile Tshabalala. Doctor, thanks for your time. We appreciate it. So let's start with your current infections and the increase there. In terms of your capacity to deal with it in hospitals, how's that looking?
Good evening to yourself, and good evening to the people watching your program. We can report to yourself that as far as we are concerned, we are worried about the increasing numbers of people who are getting infected. We're also concerned about the numbers that also need to be admitted. But so far, our bed capacity tells us that both in the private sector and the public sector, we still have enough space to admit people. We are worried about the fact that even if the admissions are fewer than what we expected, the prognosis seems to be a very serious in the sense that these are people who need to be in ICU or high care. That is the worry. For instance, there are hospitals where we've seen very, very high numbers of people being admitted. That is worrying us as a province.
But you are able to handle the numbers as it stands, right?
So far, we can say that we are able to handle the numbers. We can report that in terms of our available beds or beds that have been prepared purely for COVID-19, less than 50%, in fact, around about 38–40% are being occupied. And that level is for different arrangements that we've done. You will remember that there are beds that are solely for isolation, some for PUIs, some for ICU and high care. ICU and high care is worrying us more than general PUIs and isolation. But so far, we are coping. However, we're worried about the fact that the numbers are increasing, not only numbers of the elderly, but we're also starting to see numbers of young people being infected, and we are worried about that aspect as well.
Yes, and let's talk about the younger people. Are you seeing an increase in hospitalizations? Is there a concern for parents who are sending their children to school?
There is a concern for parents who are sending children to school, where you find that there are schools that have become sort of clusters of COVID-19 positive children. But also we then are asking ourselves, having discussed with the community in the province and then the country in general, we are saying once you find yourself to be having symptoms, flu symptoms, regard yourself as having COVID-19 until you test and you are certain that you are not COVID positive. Are people really adhering to that? And when people are still waiting, either isolation or quarantine, do they adhere to the regulations that they are supposed to? We are hoping that is happening, but the numbers that were increasing makes us think that to a degree there still is movement of the virus, and the only reason a virus can move is when people move themselves with the virus in them. So these are the issues that we are trying to address. I think the MEC for Health in KwaZulu-Natal, Ms. Nomakuku Smelane, the Premier and all the MECs are on the ground trying to speak to the issue of adherence to the regulations, adherence to all the means and ways which people must take to ensure that we prevent the infection. But when people have been infected, also the behavior of those that are infected and the behavior of those that are assisting the infected ones. But we are also preaching in terms of people coming for vaccination.
Yeah, I want to get to vaccinations in a moment, but given that you agree there is some concern for parents who are sending their children to school, given that the Education Department is encouraging that, would you suggest then that we move away from all primary school pupils going to classes daily?
No, we cannot do that. As I said, there are clusters that we are seeing. Where there are clusters, we should follow the protocols of making sure that we reduce those clusters. Where we find that there are contacts, we should deal with those contacts. Remember, at the end of the day, we are dealing with a disease that has proven to us that it is not with us for only a single wave. We are in the third wave. We may be going for a fourth wave. If we are going to say we are going to stop all the other amenities of life and the social being of all our people, at the end of the day, we may find ourselves in difficult situations as a country. So it's a matter of us saying, how do we navigate the situation around COVID-19 while we ensure that the needs of the people of our country are met, be they school-related, be they work-related and other social ills, but the adherence to the regulations are more critical, and we need to preach that again and again as long as they are not happening.
All right, I get you. I understand fully. Let's talk about the vaccination drive then. Are you seeing a decline in people coming for vaccinations? Is that a concern for you? Do you have any idea why that's happening?
We definitely have seen a lot of decline, and we're very worried about that. We as a province had aimed to, I will use one example, we had aimed to vaccinate more than 955,000 people of the age 60 and above. Up to now, we've only reached just above 500,000, and we think that is a number we are not very, very happy with. We are seeing also with all the other age groups that the number of people who register to be vaccinated and the number of people who come for vaccination, there is a very big discrepancy. We're worried about that. And we also have realized that some people are not coming in because of, among other things, the fake news that get to be spoken about. Some have their own fears informed by, among other things, the news that people have died from COVID vaccination. But even if we have confirmed that in our country that has not happened, research has been done, that has been confirmed that nobody has died from being vaccinated in our country. But still, the fear that has been inculcated still forces some people not to come for vaccination, and many other fake news. So we are worried about that. And again, we have a demand creation strategy which we have devised, particularly for the people at 35 and older. We also will be continuing with other strategies for all the different age groups, hoping that that's going to work. But also we are increasing our access to those that are far from our institutions, using, among other things, the mobile services to take the vaccines to where people are, so that there is no excuse for anybody not to come for the vaccination.
And just in terms of the first and second dose, when it comes to Pfizer, Dr. Tshabalala, are you seeing people missing the second dose at all?
I think after the protests that have happened in our province, we've seen that going down drastically. But during the time of the protests, yes, people did miss their second doses, but now we seem to be catching up for those, because we also phone people and look for them, and we are catching up on the people that are supposed to get their second doses. So we are not very much worried about those that are motivated to vaccinate and may have missed their second doses because of whatever that may have happened during the period starting the second week of July. But we are still worried about those that have not even started with the first dose.
And then lastly, of course, many people are working. So when they have to go for their first or second jab, there's that reality of waiting an hour or two and they're not able to get off work for that to happen. Are you considering then, and I know you have been already in the province, ramping up the vaccination drive and opening up more sites on weekends for those who can't make it during the week?
We have our sites being opened on weekends. We have also now started to experiment or implement what we call the drive-through vaccination sites. We also are starting to say those that would be coming to our institutions for anything else other than COVID-19 vaccination and are eligible for vaccination, we want to integrate our screening for COVID-19 in our clinics particularly, but also in integrate the issue of vaccination. Our objective is that let's reach this herd immunity as soon as possible. Our objective is that let's save as many lives as possible. So we are doing any and everything possible, including the issues of communication as much as we can, because that is what we think is making people hesitate to come and vaccinate.
All right. Thank you so much for your time and your insight. Appreciate it. Dr. Sandile Tshabalala, head of the KwaZulu-Natal Health Department.